I'm Dr. Patel, the Invisalign provider here at Serenity Dental. I'm here to talk to you a little bit about Invisalign. So these are the actual trays for Invisalign. So you wear these trays during treatment all the time, except for when you're eating, drinking, brushing, and flossing. When you're drinking water, you don't have to take them out. So you're going to wear the trays roughly 20 to 22 hours a day. Remember, they only work if you wear them. Conventional braces, they're on there 24 hours a day. These are on 20 to 22 hours a day. So you want to make sure you wear them as much as possible. I'm going to talk to you a little difference, some of the differences between Invisalign and conventional braces. So about myself, I've been doing Invisalign and conventional braces since about 2004, and I stopped doing conventional braces about 2015, solely do Invisalign only now. So some of the reasons why I stopped doing conventional braces. Number one, in the beginning when I first started, there was only about 50% of the cases that we could even do with Invisalign. Now I can do about 90 to 95% of them. Secondly, as soon as I started doing more and more cases, I started moving up in the ranks of Invisalign as becoming a preferred provider and a gold provider. So my costs started decreasing, so I could pass the costs, the savings on to the patients. And at a certain point, if I wanted to do Invisalign or conventional braces, the cost difference was only about $200. Most of my patients decided they just wanted to do Invisalign then. So I just stopped doing conventional orthodontics altogether. Also with conventional orthodontics, when you have braces, the metal braces and things, most of my patients, they didn't want to have metal braces. You can't eat what you want. You have to be careful. Nothing hard, crunchy, sticky. You cannot chew gum. With the Invisalign trays, you're taking them off so you can eat whatever you want. Hard, crunchy, sticky. If you want to chew gum, take them off and chew gum for half an hour, put them right back on again. Conventional braces, hygiene is very important. You have to be very, very meticulous in keeping all those brackets and wires and everything clean. With Invisalign, again, you're taking them off, you're brushing your natural teeth, flossing, putting them right back on again. Another advantage is with the conventional braces, when you have those brackets rubbing on your cheeks and gums, it becomes very irritating. They irritate the gums. Number one complaint I used to have, my gums are getting torn up. So I give them wax. Number two complaint, it's so messy with the wax. Well, with Invisalign, there's no brackets, no wires, there's no rubbing on your cheeks or anything, nothing's irritating at all. So a lot more comfortable to wear, a lot more transparent. I have a lot of my patients who even wear them during photographs. They say it makes their teeth look really shiny and glimmery in photos as well. So cosmetically, a lot more appealing. So the first step in Invisalign is we take a digital scan. We're one of the few offices in this area that have the iTero digital scanner. The advantage of that is versus taking the old school impressions when we ship them out to California, they're going to warp just slightly, enough where the trays fit good, they look great, but there might be some small 0.1, 0.5, 1 millimeter warping, which does affect some movement. With the digital scan, it's a true image of your teeth. We send that to Invisalign. About a week later, we'll get some images back of what your teeth look like now and what they're going to look like when it's all done. So I bring the patients in for these viewings, whether it's 2 months or if it's 2 years. So that way you can actually see what the outcome is going to look like. There's no questions of what's going to happen. We can show you the true reality of what the outcome will look like. Sometimes you may have an image of what your teeth may want to look like, but that may not be the true reality. So we want the patients to have a full understanding. After that 2 weeks, we get all of your aligners in. The first visit you come in, we try on the first aligner, make sure it fits well. That's tray number one. The second aligner, you're going to change out yourself at home in 2 weeks. You'll come back in a month. The third aligner we try in the office. The fourth, you're going to change out yourself in 2 weeks. So every 2 weeks, we're changing these aligners out. Odd ones in the office, even ones at home. Now, once you're all done with the treatments, you will get a retainer. Retainer, again, looks very similar to this, just a little bit more rigid. Now, with any type of orthodontics, conventional orthodontics or Invisalign, lingual retain, gold orthodontics, anything you do, you have to wear a retainer. Most orthodontists now are telling patients you should wear a retainer a lifetime. If you don't, the possibility of your teeth shifting again is going to be high. So with the retainer, there is a protocol, and we'll go over the protocol once you decide that you want to start Invisalign. Essentially, the protocol is you have to very often in the beginning. As time goes on, you wear it less and less, but in about a year, you should be wearing it at least once a week, just overnight. Say it's Sunday night you wear it, Monday morning you're all done. So we can go over more about protocols with retentions and retainers once you've decided to do Invisalign. If you have any further questions, we can answer all your questions for you regarding Invisalign and any of the other orthodontic treatments.